agree to this, that DM has been a disease that has attained a pandemic proportion worldwide. And the knowledge of an integrated approach in diabetes mellitus is the need of the hour. And for this very reason, today we have with us a very eminent speaker and a clinician with a vast experience, Dr. Lenny da Costa. Dr. Lenny da Costa is a consultant geriatrician, preventive cardiologist, and an anti-aging specialist. He did his basic MBBS from the Goa Medical College and completed his specialization in geriatric medicine from the MS Ramaiah Medical College, Bangalore. He has further undergone training in the practice of anti-aging and preventive cardiology. He is certified by the International Board of Clinical Metal Toxicology USA as a FCMT. He has also been certified by the American Academy of Anti-Aging Medicine in the field anti-aging medicine. Dr. Da Costa is a member of a number of medical organizations, including the IMA-CGP, Research Society for the Study of Diabetes in India, GPA Greater Mumbai, and the Geriatric Society of India, to name a few. He is currently the president of Society for Regenerative Aesthetic and Anti-Aging Medicine India, SRAAMI, president of Indian Society for the Study of Metal Toxicology and Chelation Therapy. He is a scientific advisor to the World Academy of Anti-Aging Medicine Asia. He is an executive council member of European Council Aging Research and Training, ECARE. During the course of his practice, Dr. Da Costa has lectured in various conferences and teaching workshops on anti-aging therapies, the use of chelation, IV nutritional regenerative therapies, metal toxicology, preventive cardiology, BHRT in geriatric cases, IV therapies for diabetes, etc. He is a faculty member of the International Board of Clinical Metal Toxicology and the Indian Society for the Study of Metal Toxicology and Chelation Therapy. And he has been a member of the teaching faculty for a number of national and international workshops for doctors. He has been a distinguished speaker at many international meets, including ICOPRAM Istanbul, SAARMM Kuala Lumpur, Malaysia for the last 4 years, A4M Bangkok, Thailand, A4M Asia, Bali, A5M Melbourne, Medicoin Goa, INMA Cochin, name a few, and ACNAM Melbourne. He has conducted independent workshops on IV therapies and heavy metal detox at many international meets. Dr. Da Costa has, over the last 15 years, treated more than 25,000 patients suffering from IHD, CAD, diabetes mellitus, and other chronic degenerative disorders. Dr. Da Costa currently visits affiliate clinics in Pune and New Delhi, while having his own clinics in Mumbai and Goa. With this, I extend a warm welcome on behalf of all of us at HMAT to you, sir. Thank you so much, sir.
Thank you for that. Thank you for that gracious introduction. Really, really grateful for that. Dr. Gauri, do I start now?
Very much, sir. Please go ahead, sir. We wait.
I can share my screen?
Very much, sir. Please.
Okay. So before even I start, a very big thank you to the Homeopathic Medical Association of Telangana for actually inviting me here and getting me to give this oration. I'm truly grateful more than anything for all of you who are spending your Sunday afternoon in pursuit of knowledge. And I think there's nothing greater than that when you're a doctor and you want to do something good for a fellow human being. That you spend your free time on a Sunday to learn something or to gain some knowledge which may help a fellow human being. So my grateful thanks to each one of you for being here. I hope I'm able to add value to you through this evening when I do deliver what I have. And right at the outset, let me say this, that what I'm speaking to you is what I practice. I use it in my own practice. I've been able to help patients. And so I want you to be able to incorporate anything that you can from what I'm going to be speaking this evening into your own practice. Having said this, medicine is a universal language. Irrespective of what kind of medicine you practice, the base in anything is to do good, to elevate the suffering, and to help a fellow human being. And if you have that much in your heart, you will always ensure that you do your best to ensure and lift the suffering of a fellow human being. Today's session, I would love it to be a more of an, what do you call it? Something that we can relate to each other. We can talk to each other via chat. I want you to respond to what I'm saying, because it's very difficult to give you good amount of data on a screen that does not respond. It's much easier when you're doing it in a hall, right? So I want you to interact with me. Let's make this an interactive session. Whenever I ask you questions, even if it is just to type out a yes, I want to know whether you are understanding what I'm saying. So please help me with that. And secondly, I'd like you to pay attention to the entire session, because you might think that what I'm saying is something very basic. Yes, we start with something basic, so hold on till the very end to understand what I'm trying to tell you. There are parts of this session that will go right through. And the last request to each one is to mute yourselves, please, because it disturbs me as if I'm going to give you the best, yeah? So please mute yourself as far as possible. Keep yourselves muted. And if you need to ask any questions, the chat is open. I have another system here with me where I have logged in on, so I can see the chat. I will respond even during the session if I need to at that point in time, because if I feel that you're not understanding what I'm saying, I will respond at that point in time. Is that clear? If you have understood all this, I want you to do the first response today. Please type in your chat box, yes, ready to go. Yes, ready to go. Can you please type, as many of you who can, please? I want to see how many of you are really responsive. Thank you. Thank you. Thank you for all those responses. Dr. Shilpa, Dr. Ram, Dr. Lata, Dr. Venugopal. Thank you. Thank you. Thank you, Dr. Amina. Thank you. Yes. Yes. So we are ready to go. Let me share my screen with you. So what I'm basically going to speak to you is what are the measures that you can take Can you see my screen? Can everybody see my screen? Can everybody see my screen? Am I audible? So if I'm audible, please type out loud and clear. If you can see my screen, you please say
yes.
Thank you. Thank you. So what I'm going to be speaking to you today is basically measures that you can take. And if you do it right, you can reverse diabetes completely. And these measures are things that any doctor, irrespective of what kind of science he practices, whether it's allopathy, homeopathy, Ayurveda, anything, even naturopathy, can implement for his diabetic patients. But for that to understand, I want you to understand the science behind it. If you understand the science behind it, you will be able to go out and implement it for the benefit of your patients. So let's get started. To start with, let's begin with a broad overview of what diabetes is all about. And I think most of you know this. It's a revision for you, but I'd like to state this upfront so that you understand what we need to reverse this, okay? So people are generally diagnosed with diabetes when they have persistently high levels of glucose in their blood due to an inability to produce or ineffectively use insulin, all right? So it could be a lack of production of insulin or non-proper use. Now, insulin is a hormone that we all know that helps digest the sugar or glucose, as you say. whenever you eat something,
ఎప్పుడు
can
నేను
we,
వేసుకోలేదా?
can we please mute? Whoever is the moderator, can you mute everyone and then unmute me, please? Thank you. Thank you. So whenever you eat something that contains carbohydrates, your body breaks down carbs into glucose. That is something that we all know, right? Now, when this happens, there is a rise in your blood sugar, and this triggers the pancreas to secrete insulin, which then goes about clearing that glucose from your blood and moving it into your cells where it is used for energy or it is stored in the fat cells. Now, as glucose levels drop, so also the insulin levels in your body drop. This is what we call insulin response, and this is a normal insulin response. But when this becomes too much and it goes too high, that is when the trouble begins. So, to begin with, what are the types of diabetes that we have? We have 3 types of diabetes: type 1, type 2, and gestational. Are we getting this? Type 1, type 2, and gestational. People who have type 1 diabetes, also known as juvenile diabetes, they just don't make insulin. So they have a basic problem from birth. They have a congenital problem, which is that they have a defect in their pancreas that don't make that insulin. Now, what then the reasons for that, we will not get into, because that is not going to be our area of discussion today. When they eat sugar, glucose circulates through their blood, but they can't get it into their cells because there's no insulin. So these people have to take insulin via exogenous means, that means injection. And hence, type 1 diabetes always is seen in younger children, in adolescents, and is relatively uncommon, accounting for about 5 to 10% of all cases. And today there is some literature that says that it could be of autoimmune origin. Now, most types of diabetes are type 2 diabetes. Now, this is called adult onset diabetes. Because people who develop it, they do see it when they are much more adult. Today, you see it even in younger adults at the age of 20, 25, and even earlier, even at the age of 18, with a subdivision called MODY, maturity onset diabetes of the youth. But they are all adult onset diabetes. Even as you go beyond, most of the times you see it today between the age of 35 to 45. Now, when you have type 2 diabetes, you either don't generate enough insulin, that is one thing, and that is sometimes seen in people suffering from MODY. But you also you become insulin resistant. And that is a big number of our people in India, especially in India. It's a huge number. Now, insulin resistance occurs because there's too much of sugar in the bloodstream too often. And so what really happens? Let's understand what this insulin resistance is all about. It is when your body releases insulin, it is normally released in proportion to the amount of glucose in the blood. But because we eat too much of processed sugary foods, we need a lot of insulin to kind of digest that glucose, to get that glucose into the cells. The problem is too much of insulin over a prolonged period of time, it overwhelms the cells. So what happens? The cells do not recognize insulin when it circulates. When this happens, the insulin cannot put that sugar into the cells. They can't put that glucose into the cells, as a result of which there is high glucose in the blood, there is high insulin in the blood. Now, when this chronically high levels of insulin are present in the blood, they are associated with inflammation. And this is the primary cause of heart disease in diabetics or high blood pressure. And they can exacerbate other and kind of create other inflammatory conditions, including arthritis. So insulin resistance basically is one of the biggest problems that we see in type 2 diabetics today. And if you can tackle this, you have hit the nail on the head. Now, just before we carry on any further, let's look at the third kind of diabetes, which is gestational diabetes. And this is normally seen in pregnancies. It affects women. Now, there is a lot of literature which goes on to say that Hispanic women, African American women, and Native American women are people who are more likely to develop diabetes, but also women who are obese or who have family history of diabetes. So this is something that there is a genetic kind of predisposition to. But most cases of gestational diabetes resolve once the baby is born, and that is the key. They resolve once the baby is born. That means they are no longer diabetic once the baby is born. But there is an increased likelihood that this woman may develop diabetes later on in life. And here, as a physician, when you take family history, if you know this, what I'm going to discuss with you today comes to your paramount importance, because you can incorporate those changes in the lifestyle of this patient to prevent her from developing diabetes. All right. So have you understood where I'm going with this? If you have, please just type yes in the chat. I just need to understand whether you're with me so far. Thank you. Thank you for those responses. Are you there? Great. Great. Thank you. Thank you. Thank you. So what are the risk factors that do affect type 2 diabetes? So besides age, family history, race, ethnicity, most risk factors are lifestyle related. And that itself is a clue to you. If you want to reverse, then you need to know what to do with your lifestyle. So what are they? Obesity, physical inactivity, high sugar diet, or even a high glucose diet, or a high carb diet, very high carb diet, and glucose dysfunction. All right. So these are the factors that do affect you, or the risk factors that do help to go about causing the diabetes in you. What are the signs? And I think most of you know this, but I still put it down. Excessive thirst or dry mouth, feeling hungry all the time, even after eating, frequent urination, headaches, irritability, fatigue, and blurry vision. Okay. Now, there are two very important indicators that we don't look at, because when you have these two indicators, chances are that you will become a diabetic or you will have abnormal sugar levels going forward. So if you are gaining weight, it could indicate that your body is not effectively using glucose in your blood, but it is storing it as fat instead. So that is the first clue that you get well in advance that you could become a diabetic, or you could develop diabetes. The second one is if your pressure constantly stays high, it keeps rising. Why is this? Because too much of insulin in the bloodstream promotes what we call smooth muscle growth in your blood vessel walls. This leads to a buildup of the plaque. Arterial plaque causes arteries to thicken and become very hard and rigid, which makes the heart work harder to drive blood through the arteries. Hence, blood pressure rises. That is the reason why, well before you become a diabetic, you will be a hypertensive. And so most of my patients, younger patients especially, they will come to me well in advance to tell, they come well in advance and say, we've got high blood pressure, at least 2 or 3 years before they develop diabetes, if they don't do the lifestyle changes we put them through. If they go through the lifestyle changes we put them through, if they go through the detox processes we put them through, nothing happens to them. So these are the two indicators in any young adult that you need to look for if you want to intervene and help this patient not become a diabetic, and that is the key. You should prevent diabetes as far as possible. It is preventable if you take the right steps at the right time. Now, what are the numbers? Let's look at the numbers that we look at to determine whether you're pre-diabetic, diabetic, and these are very broad numbers, things change. But generally what we as practitioners look for, we look for blood sugar levels, fasting, random, and postprandial. and I also do HbA1c. And I have a whole lot of other tests that we do when we actually treat diabetes, but those are different. And I'm not going through that over here because that goes through a very detailed management of diabetes. So I'm not going to touch that, but I just want you to understand this much, because this will help you at your level to actually help these patients. Now, if you have a fasting glucose of 100, preferably around 70 to 80, that means you are absolutely normal. You have an optimum glucose utilization. If your HbA1c is 5.9, it is still normal. But this is a warning. This could be pre-diabetic. It could be telling you that this patient will develop diabetes going forward. The other red flag that you need to look at is when your HDL levels have gone down and your triglyceride levels have gone up. This also tells you that you're eating too much of carbs, and you're putting all those carbs are not getting used up for energy, but are being stored as triglycerides. So the first thing you need to understand is cholesterol levels don't go up because you eat fat or oil. It goes up because you eat too much of carbs. Why? Because too much of glucose or excess glucose in your blood gets stored as triglycerides. And from triglycerides, you get LDL, HDL, VLDL, LDL, HDL, all right? So if triglycerides go up, it's telling you that your sugar is getting stored as fat and not being utilized as energy, which it should have been doing, okay? So that's a red flag that you need to look for. The other thing you need to look for if you want to actually treat a diabetes patient is look for his fasting insulin levels. This is one of the major markers that we look for. Fasting insulin levels, not fasting sugars, fasting insulin levels. And if those fasting insulin levels are above 9, not what the lab says, but if they are above 9, this patient in the next 3 to 5 years is going to develop diabetes. All right, he's going into insulin resistance. So what is the importance of diabetes prevention and management? It is important because you want to significantly if you mismanage diabetes, it significantly limits the quality of life. So you want to improve the quality of life of your patients. It leads to a whole host of complications, including cardiovascular disease, kidney disease, loss of vision, nerve damage, amputation, cancers, and even death. These complications are primarily due to the damage that chronically high blood sugar levels cause. As this damage accumulates, the vessels become stiff, less responsive, and more narrow, which then kind of decreases the blood flowing and the delivery of nutrients to the various tissues where these blood vessels have narrowed. That is the reason why if you have diabetics getting wounds on their feet, they do not heal very easily because there's not enough blood supply there. Now, this type of damage is so significant that people with diabetes age about 15 years faster than people without the disease. So that is how bad diabetes is. So it's better you prevent it or manage it as early as possible and try and reverse it as far as possible. Okay. So although there's no known way to prevent type 1 diabetes, you can prevent and in many cases even reverse type 2 diabetes. And let's see how. So what are the measures that you use to prevent, control, or reverse diabetes? You would want to monitor the amount of glucose in the blood. Obviously, that's the first thing. Then you need to maintain those healthy cholesterol and triglyceride levels. And for triglyceride levels, 90% of the times you need to cut your carbs. So that's the second thing. Third, maintain a healthy blood pressure levels. And we'll see how that is done. Eat a healthy non-inflammatory diet and we'll see what that is. Exercise regularly and we'll see how, because most doctors tell their patients, please exercise every day. Nobody tells you how to exercise every day, all right? Then you need to lose weight. And this is another thing that doctors tell you, lose weight. But you know that losing weight is easier said than done. And because it is easier said than done, it's a multi-billion-dollar business today of losing weight. And not many people succeed. So there again, there is a hack, and I will discuss it very briefly with you as we go along. Then you need to manage stress. Another very, very easily said thing by every doctor. You need to decrease your stress. You need to manage your stress. Nobody does it. And there is an easy hack for that. And if I don't tell you at the end of the session, please ask me that question. So I want to see how attentive you are, because I don't think I have put this in my presentation, how to manage stress. But I'll give you a hack. And I've got a video on that as well. A lot of people use it, and I will tell you how to do that. And then you need to regularly monitor your disease markers. And what are your disease markers? Your sugars, your HbA1c, your fasting insulin levels, your HSCRP levels, your inflammation markers. All these markers need to be monitored regularly every 3 months to ensure that you kind of control your diabetes and keep it in check all the time if you have not been able to reverse it to that. All right. Now, having said this, let us try and understand how we will attain this. And to understand that, you need to understand the multiple factors that interact to influence any kind of disease or the health of an individual. So what are those factors? So you have to look at a tree. Basically, all that you see on that tree are the leaves, are the branches, right? So that is what you see, whether you see diabetes, whether you see disease, whether you see healthy aging, whether you see dementia, all that is what you see. But there is something far more important. That is, what are the causes? What is it that holds that tree? Why is it that tree is so strong? Why is that disease happening in you? It is because of those roots. And those roots are the environment that you are in, the stress that you go through, the disease that you may have had, or your body is in a state of disease, the energy levels that your body has, decreased energy levels itself causes you to have disease. And then, of course, the chemicals and the toxic metals that hit you. Besides this, also your psyche, how your society is treating you, how your family and individual environment within the family, what is the community environment for yourself. And all of these, together with the nutrients, ensure that you show whatever branches you show, whether they are healthy living or whether they are diseased living. But the branches show depending on what you have down here. And so when you look at that, you realize that the environment that we live in drives chronic disease, drives diseases like diabetes, drives diseases like diabesity, as we call it. All right. So, and how does this happen? This happens because the environmental factors alter normal pathways leading to chronic disease. So what are those environmental factors that affect us? Our food, the way we eat, the entire food system, the entire food chain, the diet, fossil fuels, socioeconomic stress, toxic metals and chemicals that get into our food chain and into our bodies. And of course, the environment that we live in and the transportation that we use. Because remember, we were hunter-gatherers. We were supposed to move, and that movement has gone down drastically. Then what do these affect? These affect the pathways. And what are those pathways? What are those altered pathways? You create inflammation. You create disrupted insulin signaling, and we'll see what that is. And you create oxidative stress. This then leads to diabetes, obesity, abnormal lipids, metabolic syndrome, cardiovascular disease. These are things that are seen on a daily basis. I'm sure as practitioners, you see it too. And finally, as you grow older, today we are seeing a lot more patients. I'm a geriatric physician. I see a lot more patients with Parkinson's and Alzheimer's across the board. Why is this happening? This is happening because too many environmental factors are affecting our pathways and leading to disease. Now, coming back to what we are working on today, or what we are discussing today, which is basically diabetes and its reversal. We need to understand the basic problem of metabolic syndrome and insulin resistance. And this is what affects all of us in India specifically. This is one area where we don't seem to understand, because we treat everybody the same way. We decide to give a medication and not understand that there is something far deeper. So what are the initiators of metabolic syndrome? You have its causes. The first one is stress, sedentary lifestyle, high glycemic load diet, high calorie diet. Now, high fat diet. I tell people to eat high fat. But what is this high fat that is causing your metabolic syndrome? It is the fat that you use. Most of the oils in the market, the so-called heart healthy oils, the so-called oils that are advertised to be healthy for you, they are all trans fats. That is what's causing the metabolic syndrome. Toxicity in the form of bisphenols and everything else, heavy metals, bisphenols, plastics, name it. Glyphosate, which is a weedicide that is used in all our vegetables have it. Inflammatory disorders due to this, and of course your hormonal imbalances. So all of these causes initiate a metabolic syndrome. What are its drivers? The moment you have too much of high sugary food and you have insulin resistance, it increases the visceral fat, leads to endothelial dysfunction. And this is a triangle which drives itself. And what does it finally cause? It causes everything from high blood glucose to high triglycerides, low HDL, hypertension, depression, thrombosis, neuropathy. You name the number of disorders that I have named there, it causes all of this. So if you can reverse that metabolic syndrome, if you can cut the causes, go to the root cause, you are going to be able to reverse a lot of these disorders. And that is what we see when the patient is in sync with what you're saying. He does what you tell him to do. If you're successful, you will get good results in reversing a lot of those disorders. And that has been my success. That by God's grace, I'm grateful for whatever success I've had, because I am not, I don't cure disease. I only treat. And so a patient has to be an equal partner in it, and you need to get that blessing from the one above who actually helps you treat this patient. So that is where I come from. I'm grateful for what I get, but I've been able to do a lot because we have been able to follow this paradigm. We go to the root cause, right? And so when we go back to this, let us first understand what is it that affects one of the, and I'm going to work on 2 or 3 of the factors, environmental factors today. The first one that I'm talking of is toxic chemicals. So air pollution leads lead and other heavy metals, some pesticides, bisphenol A and other endocrine disruptors are some of these that also affect you. A profound public health impact in the Western disease cluster of what we call, this was a nice study that was put out. I thought I would show it to you because it actually shows what is happening in some of the most advanced countries, and it's coming into India as well. Don't worry, we are not far behind. Obesity and overweight is present in 2/3 of the US adults. And this prevalence is double in under 25 years of age. Pre-diabetes is seen in 40% of the US adults. Prevalence of diabetes mellitus is double over the age of 20 years. All this has been documented. Cardiovascular disease is still the leading cause of death, and hypertension is increasing by leaps and bounds. Metabolic syndrome, early signs of other cluster disease are seen in 35% of the adults, and it is about 55% in those above 60 years. That means more than half are suffering from metabolic syndrome. Can you imagine those numbers? And look at the last one, 5.3 million people in Alzheimer's. Next Wednesday, or this coming Wednesday, we are celebrating the World Alzheimer's Day. Half of those above the age of 84 are sick. So what have we done? We have extended life, but we have a very sick population. If more than half your above 84-year-olds are Alzheimer's disease patients, can you imagine what is the load on the infrastructure, health infrastructure? So this is what we have been able to do without realizing what we are doing, because we have started living a life on the go. We want everything instant, and this is the result of an instant lifestyle. So this is what I wanted to present before you. This is something that you need to keep in mind, because you'll be shocked by the next slide. What are the Indian numbers? Age standardized prevalence of metabolic syndrome were 33.5% overall. 24% in males and 42.3% in females. And where were these numbers? In one of the poorest states of India, Orissa. Metabolic syndrome is a significant public health problem even in the poorest states of India that needs to be tackled. Older age, female gender, general obesity, inadequate food intake, hypercholesterolemia significantly contribute to increased risk of metabolic syndrome. All of this has been published way back, and nothing has been done about it till now. Unless we go to the root cause, our diet, our lifestyles, our toxicities, our movement, we're not going to be able to handle these issues. So if you look again, look at the prevalence of diabetes in India, and these are 2013 numbers. This is about 8 years ago, 9 years ago. Right? We are just second to China. Early life experiences can influence later life health and disease. So basically, your aging begins when you are in the womb. What your mother eats when you are in the womb is what differentiates what you are going to get as you become older. There's a lot of data coming out today that though if the mother is deficient in B12, chances are that the child will develop adult onset diabetes later on in life. A lot of data, and that's been done in Indian settings. If you only need to look at it. And so with that, let us look at the mechanisms of action that actually drive this chronic disease. It's inflammation, it disrupted insulin signaling, oxidative stress. These are the three main ones, and each of them are interrelated. So what is inflammation? If you remember what you learned in your second year in pathology, we were told that the classical concept of inflammation is defined by its appearance. Calor, dolor, rubor, tumor. That means heat, pain, redness, and swelling. That was what was taught to us as inflammation. At least that was what was taught to us in inflammation when I did my second MBBS. But now the definition is that of a microscopic number. It tells us that inflammation within the arteries tells us that you are suffering from atherosclerosis or not. Right? It's a laboratory test. It tells us about inflammatory cells and mediators. Now, that was as far as inflammation goes. As far as insulin signaling goes, normal insulin signaling we spoke of in the first to second slide today. When you have the right insulin signaling, the normal metabolism, you have your blood sugar goes down, there is no artery disease, your triglycerides are normal or low. Now, when you have disrupted insulin signaling, which is mainly due to an inflammatory metabolism. And why inflammatory? Because you're eating too much of sugar, like I said earlier, and that sugar causes too much of insulin in your blood, and that insulin is so high that it remains high in your blood a long time, causing inflammation to set in. So it becomes an inflammatory metabolism, which then your body, your cells can't accept anymore, and you land up into insulin resistance or disrupted insulin signaling. This is when inflammation sets in and oxidative stress sets in. So if you have disrupted insulin signaling, you get the other two, which are primarily responsible, primary pathways for disease creation. So you have your factors, which could be environmental, but they lead to insulin signaling disruption, leading to inflammation and oxidative stress, which then leads to the disease. So you need to correct this insulin signaling, reduce the inflammation, and get rid of the oxidative stress. Because if you do that, all this will reverse. Your sugars will not be high, your arterial disease will not be high, your triglycerides will not be high. So this is where you need to put your action at. So the first altered pathway that causes these markers or these things to happen is food, or first environmental factor which causes the altered pathways is food system diet. Basically, what goes into your and my mouth. This is the first one. Dr. Lata, good question. I'll come to that answer very soon. She says air pollution, we can't do anything about it. Unfortunately, do you suggest wearing masks? Absolutely not. But I'll answer your question. And if I don't, please repeat it at the end. Okay. So the first thing on nutrition is that we are eating too much of saturated fat, which is basically trans fat, because we use a lot of these highly refined oils. We use a lot of the highly processed foods which use this refined oils, which cause the inflammation. Then our omega-3 levels have gone down and omega-6 has gone up. That causes inflammation. So you need to have an omega-3, omega-6 equilibrium. You need to have them in a ratio of 1:1 or 1:2. If you have omega-3 1 and omega-6 1:2, it is anti-inflammatory. If it goes up to 1:16, 1:25, where omega-6 is 25, it is inflammatory. And that is what happens when you have red meat, where the animals are grown in farms where they are fed corn when they should have been eating grass. So a grass-eating animal will have omega-3, omega-6 proper. A corn-eating animal will not. So red meat is basically not bad for you unless you know which red meat. Similarly, which fat is bad for you, which saturated fat is bad for you. The ones that you get from your trans fats and from all these refined oils and all that is used for your processed foods. Then we hardly have any antioxidant cover anymore. We don't eat the right fruits. We don't get the right antioxidants. So all that is low. But we are eating a whole lot of high amounts of glucose in the form of high carbs. We are carb heavy. We eat a lot of that. We eat a lot of sugar. We eat a lot of processed foods. That causes and we also use a lot of fructose. And that causes our triglycerides, arterial disease, and blood sugars to rise. And so what is the best form of nutrition? So when you have saturated and trans fats, high glycemic carbohydrates, lack of fruits, vegetables, and omega-3s and excess omega-6, you are writing a prescription for diabetes, for heart disease, and even for a heart attack or stroke. But if you start having your food which is high in fruits and vegetables, lots of omega-3s, reduce the carb content. What I mean by carb content will come to a little later, but reduce the carb content, go on to a Mediterranean type of diet where most of your food is lovely colors. Your fruits, your veggies are high in color. You have lean meats. You have, if you're a non-vegetarian, if you're a vegetarian, have high amounts of protein, but most importantly, a lot of good fats. And what are the good fats? Virgin olive oil, always cold pressed, unprocessed oils, unrefined oils. So ideal is if you have olive oil, or better still from our country, all my patients are on virgin coconut oil. We have a gift in our diet. We have something known as homemade ghee. That homemade ghee itself is good for us. You need not go anywhere else. That can be another high fat. So Mediterranean diet has high fat, high protein or moderate protein, and low carbs. And so the moment you start cutting carbs and your carbs are in the form of vegetables and fruits and not grains, you are getting the right kind of diet for yourself that will help you fight these disease conditions. And do I have to tell you anything more than this? If you follow this kind of a diet, you have, and these are studies done on the Mediterranean, Mediterranean. And I'm giving you a modified Mediterranean diet. It is, you look at just this 70% decrease in heart attacks. Can you imagine this? This is a study which was published way back in 94. 60% decrease in cardiac events in CVD patients. This was Dean Ornish in 98. 50% decrease in metabolic syndrome. Esposito in 04, that's 2004. 39% decrease in CRP. My dear friends, in CRP is inflammatory marker. If you can bring this down just with your diet, wouldn't you love doing it? Esposito again in 04. Insulin resistant, he spoke about it in the same thing. Decrease of weight. Why? Because if you have high insulin in your body, you're always going to have high weight gain issues. If you can drop the insulin levels, automatically your weight will start dropping. Also, you have a lot of prospective observation studies. These are clinical intervention studies. The others were observation studies. 80% decrease in diabetes if you follow this kind of a diet. 31% decrease in all-cause and cardiovascular mortality. You can't get better numbers than this. 20%, 22% decrease in cancer mortality. 73% decrease in Alzheimer's mortality, 20 to 25% or 30% in Parkinson's disease, and 78% decrease in childhood asthma if your maternal diet is good. So can you imagine the kind of power you have if you just change the way you eat? I'm not saying this, my dear friends. Clinical studies are saying this, and this is just the tip of the iceberg. I can show you thousands and thousands of studies that we have gone through to tell you just this. Unfortunately, none of us in the medical profession are looking at this and telling our patients the right answers. We are telling them, eat, stop rice, eat chapatis. Not the best thing to say. Not the best thing. You'll see it for a long time. You need to understand what your studies are telling you. Don't just listen to people. You need to read. And this is the reason why I put this before you. This is an eye-opener. Mediterranean diet helps you with this kind of studies. What are we talking about? We have a Mediterranean diet. We are telling you how to modify it for our Indian clientele. A lot of people come and tell me, I am a vegan or I am a vegetarian. I said, that's great, because we can still do this kind of diets for you as well. And we've got those kind of foods in India. The rest of the world doesn't have it. So that is something that all of us need to look at. And I've spent some time on this slide so that this message is one of your take-home messages. Ensure that you change the diet of your patients if you want better outcomes. Now, what does today's food plate look like for most of our patients? We eat 60 to 70% carbohydrates, 15 to 20% proteins, and 10 to 15% fats. Most doctors, conventional physicians, and nutritionists and public health experts have long claimed that dietary fat promotes heart disease and obesity. You couldn't have been more wrong. This caused people to follow a conventional low-fat, high-carb diet, which has ruined the health of millions. Nobody is responsible for this. It is us, doctors, modern health physicians, who are responsible for what is happening to the society today. We told them that you should have a low-fat, high-carb diet, and that is what's killing every one of them. That is what's causing the heart disease. That's what's causing the diabetes. That is why we have these epidemics going on in this world. Even today, the general guidelines for dietary fat intake is that it should be less than 10% of your overall diet. How wrong can you be? If you go through the biochemistry, you will understand why I'm saying this, right? Now, in our country, our traditional Indian diets had a healthy portion of fats. For some reason, we have chosen to ignore this fact, even though our grandfather generation lived with far less health problems than we encounter today with a diet that has been recommended to us. So today we are getting the so-called very scientific diet, which our grandfather didn't have. And if you had to just follow our grandfather's diet, we would have been healthier, because they were much healthier than we were today. Our overdependence on wheat, rice, and other grains has caused a huge epidemic of diabetes, my dear friends, and obesity in our country and the world over. Populations that are not overly dependent on grains and use a fair bit of fat and protein in their diets are far more healthier than ours. This is a fact, okay? Now, carb-heavy diet is one of the reasons for our ills. Overuse of grains has been the cause of insulin-resistant sin in our population. So physical markers for insulin resistance, just fasting insulin is one of them. Ma'am, you should not be more than 9. I'm just talking about it, Dr. Shilpa. I'm just talking about the paleo diet, the keto diet, intermittent fasting, and everything. I'm just talking about it. Just hang on. Anything below 6 of HbA1c is something that you don't need to manage, immediately with any medications, right? So coming back to our diets, it's a carb-heavy diet that is the reason for our ills. Too much of grains is what's causing insulin resistance. High insulin in our blood itself is a risk for heart disease, and we've seen it. So if this diet does cause excess insulin in your blood, which in turn causes heart disease. How was this diet recommended as a diet to reduce heart disease? And this is a question that most of us in the functional medicine space or the integrative medicine space are still asking and nobody's answering. So when carbohydrates are metabolized from our bodies, they form glucose. We've all seen this. But when you do not use this glucose, it gets converted into triglycerides. Now, how do you use this glucose? Because the glucose, like I said, has to get into your cell, and the cell uses it for energy that is used for your survival. Now, if it doesn't get into the cell, it is stored in triglycerides. And this is where the problem is. Higher the amount of glucose, higher is your triglyceride number. This triglyceride then gets converted into VLDL and LDL, the cholesterol markers we check for to see if cholesterol is high. So does fat cause these numbers to go up, or does carbohydrates cause these numbers to go up? Can you understand what I'm saying now? So we now know that cholesterol rises, specifically triglycerides and LDL, is not from consuming proteins or meats or high oils. It is from consuming grains. And what grains? Wheat, rice, bajra, jowar, maize, which are frank carbohydrates. This is what causes your cholesterol levels to go up, not meats, not oils, nothing of this sort. Okay? Now, this also leads to central obesity or fat around your belly. Majority of the requirements that are classified as metabolic syndrome, or as you having metabolic syndrome, all of this come with a high carb diet. Your triglycerides go up, you have central obesity, you have increased insulin resistance, and you have sugars. All of these comes about because of high carbohydrates, which eventually leads to uncontrollable diabetes coming from eating high carb, low fat diets. And what is the solution when the patient comes to us? We give them pills for diabetes, irrespective, whether it is homeopathy, whether it is modern medicine, whether it is Ayurveda. We are looking at pills to sort out our problems. We are not looking at where is the problem. We also, every branch of medicine is going the wrong way. We think the pill is the answer. It is not. It is not. There is no effort to reverse metabolic syndrome. If you go to reverse metabolic syndrome, your problem will be solved. And what is the solution? The solution is a diet change, low carb, high fat diet. And that answers your question, Dr. Shilpa. This is basically how paleo diets or keto diets came about. And just for you to understand what is intermittent fasting, it is to understand that our bodies was never made to eat 3 meals at a time or in a day. We didn't have refrigerators 70,000 years ago. And you'll say that we have evolved from 70,000 years ago. I'm sorry, we haven't. Our genetic code is not even 0.00004% different from what our ancestors were at 70,000 years ago. Then we didn't have refrigerators, we didn't have kitchens. If we needed to be hungry, we had to climb a tree or remove a root or go hunt an animal down and eat it. So we had to stay hungry for a long time. And it is those very ability of our body to stay hungry and survive is today causing disease for us. And one of that is this. So intermittent fasting is just mimicking that. So even if you stay for 12 to 14 hours, that means you have your dinner at 8 in the morning, 8 in the night, and you have your breakfast anywhere between 8 in the morning and 10 in the morning, you have attained that intermittent fasting. It will start reducing your insulin resistance. So these are some of the things that you can do to low carb, high fat diet. Let us see some more stuff. Why is wheat bad for us? Among all the grains, the worst is wheat. And what have we doctors been telling our patients? Stop rice, eat chapati made from wheat. Does it make sense to you? It doesn't to me. Why? Because 2 slices of whole wheat bread raises the blood sugar higher than 8 teaspoons of table sugar can. How can this happen when my doctor tells me? I mean, this is the question that most patients ask me, that whole wheat is considered a complex carbohydrate and that it will and when we are encouraged to eat more of it? How can we be so long? So let's understand this a little bit, and I want you to pay attention to this because this is something that you can tell your patients. A complex carbohydrate of wheat is called amylopectin A. This is highly sensitive to amylase, a pancreatic enzyme, which makes it very easy to digest and raise blood sugar rapidly, even more rapidly than pure table sugar. Wheat for breakfast, that is bread, muffins, cereals, whatever, chapatis, etc. Wheat for lunch, when you have rotis and sandwiches for lunch. Then you have wheat for dinner, where you have naans, rotis, pasta, bread, etc. And then you have wheat for snacks, your biscuits, samosas, crackers, cookies, etc. All of these result in a whole lot of increased visceral fat that encircles the intestines, heart, liver, kidneys, keeps your blood sugars levels consistently high. Wheat contains gluten, and gluten does not digest in our small intestine. Excuse my spelling mistake of gluten there. If it is wrong, I think it is single T. And this causes small areas of foci of inflammation, and any inflammation keeps blood sugar high. So for a diabetic, wheat and particularly gluten is poison. Why? Because it causes foci of inflammation in your gut. Now, the word gluten comes from Latin word for glue, due to its adhesive properties to hold the bread and cake together. It is the same binding properties that interfere with its breakdown and digestion and absorption of nutrients, including the nutrients from the other foods that you eat with that naan or whatever that wheat product that you are eating. This causes a glued together constipation lump in your gut, which goes about decreasing your digestion. It impedes that whole process of digestion. And this is partly responsible for what we see today, an increase of constipation and irritable bowel. Now, the undigested gluten also triggers an immune system attack on the lining of your small intestine. Why does this happen? Because it looks at this gluten lump or the undigested gluten as a foreign body, which then causes symptoms of either diarrhea or constipation. It can also cause nausea and abdominal pain. Over a period of time, your small intestines become increasingly damaged and inflamed. This in turn can lead to malabsorption of nutrients and nutrient deficiencies, leading to anemia, osteoporosis, and other health problems. So then you have a gliadin protein in wheat as well. This unlocks, so you have the intestinal barrier in your intestine, which is tightly locked like this. It opens this up, causing a gap there. And through this gap enters a wheat lectin. Now, what are lectins? Lectins are immune system of plants. Some of these lectins are good, like those from spinach. But what does the lectin of wheat do? This is called agglutinin. It is a 4-part complex molecule, which was when it was given to rats, it destroyed their small intestine. And that is exactly what it does in humans as well. Those who eat wheat, they have autoimmune disorders, inflammatory distress such as joint inflammation, bowel inflammation, acid reflux inflammation of the brain, inflammation of the airways. And hence, when you remove these from the diet, many of these patients completely reverse. I've seen autoimmune conditions. I treat a whole lot of autoimmune conditions reversing, and they live absolutely well as long as they're not eating gluten. They remain completely asymptomatic. What happens in diabetics? If you look at the diabetic, his sugar levels start going down. You are in control of his sugar levels, even if he's not doing anything. Just one intervention, remove wheat from his diet, and you see the difference. In addition, gliadin also acts like an opiate. So forget everything else that I mentioned over here. Because it acts like an opiate, you have a craving. So if you don't have that roti in the morning or in the night when you're having that dinner, your brain demands for it. That is the kind of demand or opioid addiction that you have, opioid-like addiction that you have for wheat. Now, why? So when you actually remove a lot of this wheat from your diet, what happens? You have improved weight loss, reduced appetite, lowered blood sugar. So your appetite is not that much to keep on eating. reduce joint pain, reduce inflammation. It has a lot to do with improved cognitive function. And I do it for my elderly patients. A lot of the elderly patients who have GERD and have cognitive impairment, I just stop their wheat and they're very, very happy. They're living a happy life. They don't have GERD anymore. I don't have to give them a PPI. I don't have to give them an OMES, or I don't have to give them anything to stop that GERD. I just stop wheat and I stop milk. This is something that most of you will fight with me. I have seen this. Many people come and tell me how. So true, Dr. Arun. So true. Millets are excellent, and I'm coming to that. So millets are high in protein. Always go by what I'm saying. Just don't go by. They are high in protein. And that's why I said India has a whole lot of food substitutes that we can use. Yes, you use millets, and you can use foxtail millets. You can use kodo. You can use all kinds of millets. Let me tell you, I have a keto diet, a vegetarian keto diet, and my high protein and high fat comes from homemade ghee and virgin coconut oil, and my high protein comes from spirulina and from pea protein, because I have even vegans who will not have whey. So when you use this, it's more than enough to handle it, and all your millets have a whole lot of protein in there, and they have adequate carbs that is just enough for you. All right. So that's a very good question. Why did wheat cultivated and eaten by our ancestors for since long? Our ancestors never ate this wheat, my dear friend. This wheat was chemically modified wheat that was given to India and China in 1965 by Americans. This is known as the high yield variety of wheat, which killed all the native wheats that we had. We used to have something called spelt, which is no longer available. And that is the basic problem. This wheat is chemically modified. America started using it in 85, and since then they are having problems. So you need to get your facts right. This is not the wheat that our ancestors cultivated. And if you look at anywhere in the country, it was wheat that came into Punjab. Punjab became the wheat granary of the country. That is where the Green Revolution started, when this wheat was sent to India by the US in the 70s. And you can see how their population has expanded into obesity. All right. So it's in no other part of the country do you have wheat being used. In coastal areas of the country, we use rice, and it's far better grain than wheat. But even rice gives you a spike in your blood. So it's better to use the millets that we have. And millets is something that we have used across our country. That's for you. I can't get your name, doctor. Yes, that is better, Dr. Latha. So there is no genetic predisposition. All of us have a genetic predisposition. Please remember something. When we came about with the human genome, we realized that if you have a gene for diabetes, you will not get diabetes unless the epigenetic factors are there. I'm answering this question. And these epigenetic factors are nothing but the environment around you. So it's your diet, it's the state of your mind, it's the state of your movement. All of that are epigenetic factors. And those epigenetic factors will influence whether that gene is switched off or not. So if you want to keep that gene off, if you don't want to have diabetes, despite having a SNP for diabetes, is to have the right diet. Have you got that, Dr. Arun? So why is cow's milk bad? It has a lot of reasons for it. It has inflammatory, and it causes inflammation, it causes mucus, it risks respiratory conditions and allergy. Why does this happen? It because casein, the protein in milk, cannot digest in the human gut and causes similar problems to the gut like gluten. They are very much alike. Sometimes gluten intolerance can cause also casein intolerance. This causes the immune system to be hyper-reactive, causing allergic conditions and autoimmune disorders. So it is touted to be high in calcium. It is, but there is not a single study across the world that shows that if you have high milk, the amount of osteoporosis has gone down in the population. It hasn't. Why? Because sometimes the milk leaches the calcium. Instead of promoting bone health, it actually has a calcium leaching effect. It actually destroys the bone. Dairy products almost certainly help cause, not prevent osteoporosis. And there's enough data for this. I've gone through data after data because, and by the way, there is a book. I don't know if I have it here. So just to prove to you, this is a book that is written by an Indian author for a thesis. What does it say? Milk, a silent killer. So you have a lot of data that has been put out. Milk does cause problems. I stop milk even for plain old migraines, and the migraines disappear. All right. A glass of milk contains acidic animal protein that leaches calcium from the bones, pus cells, feces, components of bovine growth hormone, antibiotics, and a whole lot of other things that you don't want to get into a human body. All right. Now, having gone through the food, we come to the next big thing, that is toxic chemicals. Now, toxic chemicals could be from the air that you breathe, the water that you drink, and the food that you eat. All right. You have everything from pesticides, bisphenols, and endocrine disruptors. And so you have another chart where you can see now that you have a whole lot of things. You have lead, you have pesticides, you have air pollution, you have endocrine disruptors, which are BPAs. BPAs are your bisphenols come from your bottled water. So you should not be using that water, that bottle again. Your dioxins and even some pesticides. And the worst of this, which I have not been able to put in the slide, is glyphosate. Glyphosate is a weedicide. A herbicide that they use, you know, they don't want weeds to grow in your grass, so they just put it on the soil. This gets into your food chain through the vegetables that you eat. Unfortunately, the body can do nothing about it, and it destroys the gut bacteria which are responsible for improving your immune system. And that is one of the reasons why our immune systems are so frail, that we get hit by a small virus called a coronavirus and we have a COVID pandemic. All related to the food we eat, my dear friends. If we eat the right food, nothing happens. So you have to avoid plastic containers if you don't want these endocrine disruptors. You need to avoid plastic water bottles. Use glass water bottles to store your water. Please tell your patients to do that. Use stainless steel products. Don't use any others. Avoid Teflon coated pans and cookware. Why Teflon? Teflon also has endocrine disruptors. Eat organic or local vegetables and fruits. One of the best ways to sort your problems. So desi cow milk is something better than what we have today. And yes, I do allow you to have desi cow milk because the casein there is totally different. All right. Now, the heavy metals that we look at are very high, and most of you will be surprised at the kind of heavy metals that we have. You have all of them: lead, cadmium, mercury, and arsenic entering our food chain. How do they enter? From the air that you breathe, the food that you have, and the water that you drink. All of them have got heavy metals. They are primarily responsible for chronic disease, my dear friends. And so how do these heavy metals work? How do they cause problems for you? Now, if you look at this diagram, just look at what is happening here. You have a functional metalloprotein where zinc goes and sits there. Zinc is a normal mineral that is required as a coenzyme or a cofactor for a whole lot of biochemical reactions in your body. Now, when you have cadmium, cadmium goes and mimics zinc and sits on the same receptor. What this does is it inactivates that metalloprotein, and that biochemical reaction doesn't take place. If the biochemical reaction doesn't take place, your body becomes sick. This is how heavy metals create problems. They go to inhibit membrane transport processes that transport nutrition across membranes. They cause phantom type reactions leading to a lot of oxidation, which we don't want to happen. They create redox reactions, and they also substitute ligand binding. So these are some of the ways it does. And so one of the first studies that actually looked at it was this particular one, where Dr. Mark Lustberg of the University of Maryland School of Medicine actually spoke, and he, along with Dr. Alan Silberg of Johns Hopkins University, they gathered the data of the 2000 census in the US. And this was the massive third National Health and Nutritional Examination Survey, which was known as the NANS 3. So they gathered this documentation and they looked at it and they realized that where the blood lead levels were even as lower than normal. At that time, the normal was considered 30 micrograms per deciliter. But even for people who had lower than what is normal, if there was lead in the blood, then the cancer mortality went up by 67% in people less with normal levels of lead. Cardiovascular mortality went up by 46% and all-cause mortality went up by 39%. Can you imagine this? Can you imagine this? So if you look at just this, they came to a conclusion that there is no safe level of lead. Lead is one of those heavy metals that we have in the air because of the huge air pollution and leaded petrol and leaded fuels that we have used over the centuries now. I mean, for the last whole century. Lead, today we still use lead for our wall paints. There are toys that come with lead in it. So lead at any level contributes to disease-related mortality, especially from heart disease, cancer, and other degenerative disorders of the aging. There was a very big study that came out, lead and vascular disease, and it showed how lead exposure over a period of time caused chronic heart disease, caused stroke, caused peripheral arterial disease, called arrhythmias, and left ventricular hypertrophy. There was another one which showed that you have high lead levels associated with myocardial infarction and stroke. Nobody looks at this, but these levels were far lower than what was considered normal. How does lead affect us? It affects us by stimulation of this renin-angiotensin system. It downregulates nitric oxide. It increases oxidative stress, autonomic dysregulation affecting heart variability, endothelial inflammation, smooth muscle proliferation, endothelial dysfunction. Whole lot of mechanisms. It also ensures that your methylation cycle, which is the key to your healthy liver, is destroyed. And therefore, when you look at high homocysteine levels, always remember that this patient has problems, is going to have diabetes, and is going to have heart disease. Why? Because lead inactivates two important enzymes, delta aminolevulinic acid dehydrogenase and glutathione reductase. As a result of which your glutathione goes down, your homocysteine goes up. Then you have hypertension. Lots of studies on this NANS3 to show you that hypertension is caused because of high lead in you, and there are ways to detect this, not a blood test, okay? Lead concentration in subjects with metabolic syndrome was significantly higher than those subjects without metabolic syndrome. This was in 2013 for the first time. A Korean study showed the link between lead and metabolic. Somebody mute. Thank you. People with the highest levels of exposure to mercury, persistent organic pollutants had 11 times the risk of insulin resistance than those with the lowest exposure. If you have low insulin resistance, you will have diabetes. This was another study that came out in 2010. Each component of metabolic syndrome was associated with both mercury and persistent organic pollutants exposure levels, including an increased waist circumference. So you can imagine how much of data there is. A large prospective study of US adults found that those with the highest levels of mercury exposure had the highest risk for diabetes, as well as lower beta cell function. Where does your mercury come from? Mercury comes from all the amalgam fillings that you have got in your mouth. Mercury comes from your vaccines, because they use thimerosal to stabilize those vaccines, to keep it's a stabilizer. It's so that the shelf life of the vaccines goes up. So thimerosal has got mercury in it. Cadmium also is directly related to metabolic syndrome. See the conclusion. This was in Diabetic Care in 2003. In a large cross-sectional study, urinary cadmium levels are significantly and dose-dependently associated with both impaired fasting glucose and diabetes. These findings, which require confirmation in prospective studies, suggest that cadmium may be the cause of prediabetes and diabetes in humans. And today we have got further studies that have come out in a lot of the journals that I've been seeing, which shows that smoking, which has high amounts of cadmium in it, which takes in a high amount of cadmium, does cause diabetes. So if a person is smoking and he is diabetic, his diabetes will never be under control. You will never be able to reverse it with all your diet and everything if he continues to smoke. Right? Now, cadmium, there's also a review of cadmium exposure, blood glucose levels, and diabetes concluded that cadmium can have direct toxic effects on the pancreas and may be a factor in development of diabetes. This was published anyway in 2009, but there are other studies also that have come out. Arsenic, which we spoke of, also is directly related to metabolic syndrome and diabetes. And this was seen in people who were exposed to arsenic in water. This was published in JAMA of all the places in 2008. Now, researchers suggest that metals like lead, mercury, and cadmium may play a role in the development of diabetes. This was a lovely paper in 2010. Heavy toxic metals also are responsible for a development of insulin resistance and other related conditions such as obesity, type 2 diabetes, metabolic syndrome, and points that these chemicals may also be involved in another epidemic that is hitting our country right now. That is non-alcoholic fatty liver disease. Practically every other patient that comes in has fatty liver. Why? Because of high carbs, too much of toxins in our body. All right. Recent studies have found toxic metals and vaccinations to be factors in increased diabetes cases. I told you the reason why. This was a beautiful paper that was presented in 2001. There are others. I have not been able to put all of them here. Mercury and cadmium inhibiting magnesium and zinc levels, as well as inhibiting glucose transfer, are other mechanisms in which mercury and toxic metals are factors in metabolic syndrome and insulin resistance and diabetes. Heavy metal overload in adrenal glands reduce production of hormones, which cause early aging, stress, decreased sex drive, and aggravation of menopausal symptoms. Again, a whole lot of things that tell you why the heavy metal should not be there. It can lead to unresponsiveness of medications in diabetic patients. It can lead to neurological disease, loss of thinking power, depression, osteoporosis, hypothyroidism, all of these. And so, my dear friends, always remember, for adults, silent symptoms of chronic low-level heavy metal accumulation in tissues can progress from a steady decline of energy, productivity, and quality of life to accelerated cardiovascular disease, premature dementia, and total debilitation. Unfortunately, the possibility of heavy metal burden is often not considered, and patients continue to suffer needlessly. So what do you do to remove these toxins? I've been talking so much about the toxins. What do you do to remove them? First, avoid toxins such as chlorinated water, processed foods, plastic water bottles, food containers, pesticides, gas fumes, medications, etc. Then use seasonable bowel cleanses with vegetables and supplements containing good bacteria, probiotics, enzymes, and fiber are a great way of increasing bowel absorption. Colon hydrotherapy is another way. Not many people have this, so I will not suggest it, but it's a great way. How do you remove heavy metals? Chelation therapy, and I'll talk to you about it a little later, but it cannot be spoken here. It's a full course that you need to do. FIR saunas is another way that you can remove heavy metals. Detoxify and cleanse the blood and other organ systems using ozone therapy. That's another one. Many of you have heard of it. So these are some of the alternatives that you have to remove your heavy metals. Now, coming again to this slide, which is affecting insulin signaling, there are two things we have not looked at: obesity and inactivity. And so what is the kind of exercise? What is the kind of intervention you need to do there? And let us look at it. Your body can select from several fuel sources when you're doing exercise. It can burn fat, it can burn carbohydrates like glycogen, it can also take energy from breaking down protein. So when you exercise for different durations at different levels of intensity, it alters the relative proportion of energy you derive from these three sources. For the first couple of minutes, your body uses something known as ATP, that is the energy within your cells. Most readily available source of energy, right? Now, from but your ATP generally doesn't last you for even 10 seconds. So you need to automatically make more. So for you to make more, it switches to carbs stored within your muscles. It uses that as energy to make more ATP. But this lasts for 15 to 20 minutes. And so if you exercise beyond 20 minutes, then the energy that is used by exercise or for your exercise is fat. So it goes into fat use. Your body makes fuel choices based on the activity level as well. So there are two things that happen: time and the kind of activity that you're doing. Now, just look at this chart. In fact, resting uses more fat than high intensity workout. So you should be resting all the time. Why work out at all, right? But you need to understand the most important component. When you have low intensity activity, your body derives most of its energy from carbohydrates and only 15% from fat. So what was low intensity activity? 70,000 years ago, you were walking slowly for long distances. This was natural because we were all hunter-gatherers. So for this, we were using only 15% of the fat, but most of it was derived from carbohydrates within our body, all right? The glycogen stored in the muscle. Then we had moderate level of intensity of exercise. Here, the percentage of energy burned from fat was 55%. And possibly this is the reason why people thought that if you burn more fat, you'll become thinner. This is where they got wrong. They got it all wrong here. And that is where the wrong advice was given. Work out for 1 hour at least. So when you do moderate level of exercise for 1 hour, what happens? We will see. Just let us see. Then what happens when you do high level activity? If you increase your activity to high intensity, reduce your dependency on the fat, you derive most of your energy from carbohydrates. Please understand this. High intensity carbohydrates. If you look at that chart, it was 97% carbohydrates, 95%. All of your high triglycerides and stored fats come from unused carbs. So the carbs get used here. To get good fat loss, you need to ensure that your fat gain, that is carbohydrates that is putting you on fat, that is stopped. So the carbohydrates are utilized. It's only high level of activity that has the highest carbohydrate burn rate, while low intensity is the second highest. Both forms of activity our native hunter-gatherers used. Why? Because they were either running away from being somebody's food or they were running for their own food. So they used to run, stop, run, stop. So it is high intensity, low intensity, high intensity, low intensity. Never a brisk walk, never moderate levels of 1 hour walk on the treadmill, never that kind of walk. What happens when you do that kind of walk? While burning fat while exercising signals your body that it needs more fat. This is exactly what happens when you exercise for 1 hour. This trains your body to make more fat the next time you exercise. Why? Because it thinks that the next time you exercise, you need this fat to burn. So the moment you cross 20 minutes and you need fat to burn, the body keeps putting on this fat. So if you stop exercising, there's a buildup and automatically you put on weight. This is what happens to professional athletes. So don't try to use this strategy. Don't go to the gym and work out for 1 hour to lose fat, to reverse your diabetes. 20 minutes maximum, 10 to 20 minutes maximum of high intensity workout is all that you need. Always remember this. Somewhere the proponents of cardio got it wrong. You need to stop your cardio if you don't want to put on fat, okay? You need to do cardio in the form of high intensity interval. The most important change always occurs after the exercise, not during the exercise period. So don't think you need to burn fat during exercise. If you burn fat during exercise, you'll put on more weight. Please remember this, you'll put on more fat. The way you exercise affects your metabolism for several days. The important changes begin after you stop exercising. It means that all you have to do during exercise is to stimulate the adaptive response you need. Then your body will continue making important changes afterwards while you rest. So what are those? You need to do exercise in short bursts and afterburn. Short bursts of exercise tell your body that storing energy as fat is inefficient. Since you never exercise long enough to utilize fat during each session. Carbohydrates such as stored in the muscle rather than fat burn energy at high rates. Now, when you exercise for short periods, when these carbs burn from the muscle, that is your glycogen burns, you need to replenish these carbs. So how do you replenish these carbs? You replenish it from reserve energy. What is reserve energy? It is fat. So from the fat creates, so the short burst creates the afterburn. So your fat will be burning for the next 24 hours, 12 to 24 hours to replenish these carbohydrates used in that 20-minute exercise. This is what you should be doing. When you start doing interval training, your BP goes down, your sugars go down, everything that you need to do goes down. 20 minutes is all that you need. 20 minutes is all that you need. And I'll show you what we do. But it's not me saying, this is what the research says. At the Laval University in Quebec, 2 groups were done, one long duration and one repeated short duration exercises. The long duration group went for a 45-minute without interrupting. They went cycling. The short duration intergroup cycled for short bursts of 15 seconds while they rested for 90 seconds. So long duration group burned twice as many calories. So you would assume they would burn more fat. That was the problem. When researchers recorded their fat body composition measurements, the interval group showed that they lost more fat. And when you lose more fat, you reduce inflammation. You reduce inflammation, you improve insulin signaling. You improve insulin signaling, you reduce blood sugar, and you reverse diabetes. So this is exactly what happened. In fact, interval group lost 9 times more fat than the endurance group. That means the group that cycled for 45 minutes. Doesn't this defy the laws of physics? Surely it does, but you need to understand how the exercise affects your metabolism after you stop. The short bursts stimulate a greater afterburn. So it improves your maximal cardiac output, it promotes quicker cardiac adjustments to changes in demand, helps you to lose body fat within as little as 10 minutes of exercise per day, achieves higher peak stroke volumes during the overload. All right. Now, it also improves your cholesterol levels. That is very important. It provides an anti-aging benefit by raising testosterone levels. It helps your libido, sexual function, strength, everything else, including your memory. It helps you to lose weight. It burns more fat, even after you have stopped exercising. And you'll be able to get these benefits much less time and no need to spend money and hours at the gym. So the cardiac case is a mistake because it produces an unnatural challenge. And sometimes this unnatural challenge causes cortisol secretion, causing you to put on more weight, causing your sugars to go up. It also fails to take into account the body's adaptive responses like shrinking internal organs, shrinking and weakening muscles, decreasing cardiac reserve capacity, and an increasing dependency on body fat for energy. One reason why a study, which I have not put here, showed that people who ran the Boston Marathon post that had certain deaths were much higher than those who did not run the thing. So there is that study. Some other time I will probably put a thing together for exercise for you. I have a lot of data on that too. So what do I tell my patients? And this is what I tell my patients. To burn fat during exercise session, create an oxygen debt. This happens when your lungs, this happens when you ask your lungs for more oxygen than they can provide in that moment. So to do this, you simply have to exercise at a pace that you cannot sustain, but it has to be for a short period of time. And so you monitor your heart rate while doing your exercise, which is good. When you finish the set, you see your heart rate go up a few points, but immediately after you slow down, it starts coming down. If you do this successfully, you will start to pant, okay? Now, the difference between your oxygen that you need and the oxygen you get is called the oxygen debt. So you start panting when this happens, all right? So this is the cause for you to pant. I ask my patients, and this is what I do. I tell them, use an exercise cycle. This is the best way to do it. Use an exercise cycle. Initially do 2 minutes of slow cycling to kind of warm up. Then 15 seconds fast cycling, extremely fast, 45 seconds slow. 15 seconds fast, 45 seconds slow. So as you when you slow down your cycling, you start panting. This is the high output challenge you cannot sustain for a long period of time. So we start with only 5 minutes. We go up to maximum 10 to 12 minutes. That's it. This itself reverses a lot of the diabetes that we have in our patients. This is the exercise I give them. Of late, I have been giving them walking at home. Many people don't have an exercise cycle. So the one thing you can do is get up, go to the loo, have a glass of water early morning, go to the loo, get out of the loo, come back and walk at your bedside. You need just a 2x2 area. We use a lot of walking videos available on YouTube. You can use any one of them to walk for 12 to 14 minutes. There is an HIIT walk. If you just Google it, HIIT walk at home, you will get it. There are lots of people doing it. It helps you to start reversing your sugars, starts reversing your diabetes, starts reversing your BP. Let me tell you, since the pandemic, I have followed this principle myself. I no longer take an antihypertensive. I no longer take an anti-glycemic. I've reversed both and I've lost a ton of weight. All right. So I've done it for myself. I've done it for my patients. And you can do it for your patients too. Okay. So what is the benefit of short bursts? You lose a lot of belly fat. You build functional new muscle. You reverse heart disease and diabetes. You build energy reserves available on demand. You strengthen your immune system and you reverse many of the challenges or changes of aging. Okay. So to conclude, my dear friends, it was a marathon session. I was given 1.5 hours. I think I've just finished, touched that. All you need to do to prevent, manage, or reverse diabetes is eat right, low carb, high protein, high fat diet, detoxify well, exercise regularly and exercise right, reduce stress and sleep well. So you need to sleep by 10:30, cut off your blue screens by 9 o'clock. This is what I tell all my patients. Reduce stress. I told you I'll give you one hack. Every time you're stressed, tell your patients this and you do it yourself. Go to YouTube and watch some comic making a fool of himself. Laugh a lot. When you laugh, you break the stress cycle. You get a lot of endorphin release. That helps you to break the stress. And hydrate regularly. Every diabetic has to get this instruction. 1 glass of water every waking hour is a must. With this, I'd like to tell you, and this was what I was requested, we have this workshop coming up on the coming weekend. It is a 3-day IV therapy workshop from 5 o'clock to 7:30 each evening, 2.5 hours each evening. There's a registration link there. It's a paid workshop. But as a special favor for all of you who have attended this session of mine, we are offering just for today a special discount. And this is a discounted link. You can go there and register if you're interested. It is just that I was told to announce what we do. I'm just telling you this. We also have a whole lot of other workshops. None of these use allopathic medications. These use alternative ways of treating, whether it is cancer, which is functional oncology, whether it is autoimmune conditions in functional immunology, or BHRT and nutrition. In nutrition, we use a lot of the supplements. So if anyone is interested in doing all 4, again, there is a special offer going out where you do 3 and 1 is free. This is to help people learn. We're just offering it. This is not for money. It is just something that I want to share with more people who will do what I do. With that, thank you for attending and giving me a patient hearing. I will see you soon, hopefully. We have masterclasses every month for free. I'm doing one just after this. I have about 300 doctors from across Southeast Asia attending it. But you could also do it. Just send us a message or a mail and we'll put you on that. Yeah. With that, I hand over the floor back to the moderator, sir. If we can take a few questions, I'd love to do that. Let me see what questions have come here.
Thank you, sir.
Yeah, I've got about 5 minutes, and then I need to, in 10 minutes, I need to leave. So my apologies. I will try and answer as many questions. Yes, 20 minutes of high intensity exercise. So you do 15 seconds on, 20 seconds off. 45 seconds off. I've explained that to you. Dr. Lakshmi, I'm not the So those of you who want my number, please take it down. It is 98230-93675. 98230-93675. All right. And you can also take down another number, 98233-86867. Send us a message on that. One of my team members will go. Even if you send it to me personally, I'll pass on your number. They will get in touch with you. So, Dr. Lakshmi, I think you have a recording. It's better to go through the recording because the presentation itself is not going to help you. Dr. Lata, that is tailor-made for each patient. I wouldn't want to give you something that one size fits all, but I've given you thumb rules in the diet, which you can use. Thank you, Dr. Arun, for those kind remarks. So you can go to the gym and do cycling as well, but you need to, whatever exercise you do it in 15 to 20 minutes. I also do weights 2 to 3 times a week, light weights, which I do within those 20-minute period. Laugh a lot, Dr. Lakshmi. That's how you de-stress. Laugh a lot. You need to, every time you feel stressed, go to YouTube. You have that on your handphone. Instead of watching some stressful videos about what politicians are doing, go and look at some comics who make you laugh, and laugh a lot. That is what you should do, Dr. Shilpa. It's a simple hack. I use it on all my patients, and all my patients are doing well. The other thing you can get rid of stress is being grateful. Gratitude helps you. Now you'll say, I'm getting into the realm of philosophy. No. Gratitude releases endorphins in your brain, which are stress busters. So when you get up in the morning and thank God for having kept you alive for another day, and thank him for another day, you are releasing endorphins in your system, which cut off the stress. When you're grateful for what you have received, there's an endorphin release. When you're happy and celebrating, there's an endorphin release. So you need to be grateful. So that's another hack that you can use. Laughing and being grateful are 2 very good hacks to control stress. Besides this, you have got your yoga, deep breathing, meditation that a lot of people speak about. But these 2 things you can do on a regular basis. So vegetarian plan, I just told you, I don't think you listened to it. We give you all kinds of millets. We tell you to have lots of vegetables and fruits, 1 or 2 fruit helpings a day, not too many fruits, lots of vegetables. Your protein comes from pea protein, and you have a lot of pea protein powders that are available. You can use spirulina, and you have lots of spirulina suppliers in India as well. That also gives you higher protein. And for fats, use homemade ghee, virgin coconut oil, virgin olive oil, or cold pressed local oils. Okay. Yes, it's the same system, same strategy, Dr. Annapurna. Thank you, Dr. Lakshmi. All right, I don't have chat. Okay, so I'm writing it from my others. Let me type it out here.
We have given your number, sir, in the chat box.
Already given. Okay, so I'll just put it again there.
Sir, any nutrients that can be of help in taking care of this condition?
Yes, so there are lots of nutrients, but always use nutrients that will improve your sensitizing your insulin to the sugar. So insulin sensitizing nutrients. One, I use berberine, which is very easily available in the country. Other one is Gymnema sylvestre. The third one is Banaba leaf extracts. These are some of the ones that you can use. Of course, you need to use a lot of chromium, which enhances the insulin sensitivity. A little of selenium. Magnesium is another one. Every patient of yours has to have magnesium. So these are some of the nutrients that you need to put for patients. All right. I've just put the number there, Dr. Hiramat. It's 98230-93675. All right, so I hand the floor over to you. Let me stop the share.
Thank you, sir. Thank you for your wonderful, informative lecture. Now, may I request Dr. Praveen Saxena, sir, for his expert comments. Dr.
Oh, by the
Praveen
way,
Saxena, sir.
Praveen, thanks for being there. I was honored by your presence. Thank you. You're muted, sir. Praveen, you're muted.
Yeah, Lenny, it was a quite extensive one, and you have covered everything here. And happy to see you with the size what you used to have. And really, see, this happens like that. When Lenny and us started this integrative medicines concept about, we were only focusing on cardiovascular health and all that. So Venugopalji, we feel that it is something, it is not a one particular thing or very simple one treatment or one prescription which is going to help everyone. As rightly said by Lenny, exercise, if it's not combined with the other modalities and all that, and he has explained it beautifully. And I can always tell you Hyderabadis, I'm just trying to address the Hyderabadis. Lenny, Hyderabad is becoming a diabetic capital, even though it is basically a pearl city. And what we have seen over here is the consumption of carbohydrates is quite high, and all the rice is has contamination with the arsenic as well as the cadmium. This is one of the big things here. And even Lenny, we have worked on the water. What was the content of arsenic in the water, which I had done something 12 years back, and we were able to show the the content of the arsenic in groundwater, which was our borewell water, was quite high. And this is what we are trying to present to other doctors also. But only thing is just trying to blame everything on the patient, telling that "Arey tum zyada khate," that putting that you don't exercise and all that. This is something which is being happening all over, and I can see a lot of this. This cannot. This is diabetes, obesity. This particular thing is coming in big. I had seen in colonies, localities, all of them having. We have picked up in Kachigoda area, one or two persons in the family. That was 12 years back, and we were able to show the water level, what was causing it. So again, I want to reiterate that this is one thing which one doctor from very integrative medicine or from homeopathy or from a allopathy point cannot handle. This is a public health issue, and all of us has to start empowering the patients, trying to educate them what is the real, this is the need of our. And Lenny, myself, and we are a big group of integrative doctors. We are always ready to partner with people, right thinking doctors, trying to tell how we can always we can go together well. It is something simple. We need to understand some of the nitty-gritties and all that, because I don't expect people who are using the same rice before and the people who are using the same rice now, why they are getting into so much problems. So the things have been changed, the rules have been changed now. The new things, new diseases are coming. We had seen with COVID a kind of it was a big a kind of wake up call for all of us. And where we were talking about all this toxicity, we are talking about all this radiation and all that. This is one thing which we have, all of us. I will definitely like to, as Venu and other panel members knows about that, and we are always with you. We are ready to see that. And see, something helps. If it is just a diet which is helping out, we are ready to become only nutritionists and all that. We basically we tried not to get uh, dictated by some pharma or some other groups telling that only this is the particular thing. So so I just wanted all of us, like, basically have. I know there are a lot of Hyderabad doctors are listening to this, and yes, this is a good way of looking into the things. And yes, I am always I always look on Venugopal and other doctors to see how best we can work it out for the patient. And any you there were very good intelligent questions were raised, and I really appreciate that. And this is what is lacking in the other side of the stream, because when we asked the topmost endocrinologist why there is an increase in diabetes in Hyderabad, he has a only single answer that the pizzas and burgers were not there. This everyone is eating pizzas and burgers, and that's the reason we are getting. So this is something we are not totally trying to understand what is the root cause of the disease. And the root cause is definitely this air pollution, this water, as so many things. And we can always optimize our bodies, how to excrete things well. And if we can optimize the body, yeah, we need to really, we need to laugh out. We need to do exercise, so many things. And the most important thing, I think one of the things Lenny told was cut down the blue light at 9 p.m. and sleep at 10:30 p.m. Because if you don't cut that light, cut down that blue light, what do you mean by cutting down that blue light? Cutting down that blue light means don't see the cell phone, don't see the TV LED screens, because the moment you are seeing that screen, you are getting that blue light, and your basic thing is you get into something like melatonin is not released, and you get into problems. I thank one and all for attending this particular session, and this is really interesting. And there are more number of doctors who are trying to see what is there on the other side also. And Venugopalji, hats off. Sampath Rao-ji, hats off, sir, all of you. And thanks for inviting me, boss.
Thank you, Dr. Praveen Saxena, sir, for your great informative comments. Now, may I request the president of our association, Dr. Gopal Krishna ji, for your comments and the vote of thanks. Dr. Gopal Krishna.
Dr. Sampath.
Yes,
Yeah.
yeah. You are audible.
We had a very informative talk by Dr. Lenny Costa. So we profusely thank him for giving us such a knowledgeable lecture. And we are very grateful to all the participants, and especially Dr. Praveen Saxena and Dr. Ajit Kulkarni and all the eminent people who have participated in the session. And we, as Dr. Praveen Saxena said, we probably need in line many such sessions to educate us further, to know many useful and necessary details a physician has to know. So we once again thank him, and we thank the sponsorer, and we pay our rich tributes to Dr. Gauribai Kirtane on this occasion. And thank you one and all.
Thank you, Dr. Gopala Krishna. The session ends here. Thank you, one and all.
Thank you.